Next we're going to do heart and peripheral vascular inspection, palpation, and auscultation. You do have to name the cardiac landmarks, the rate, the rhythm, the quality, where the S1 and S2 are best heard, and then the peripheral pulses are the carotid, temporal, brachial, femoral, popliteal, dorsalis pedis or pedis, and the posterior tibial. So you're looking at your patient. You can name them on yourself if you want, okay? So you have the aortic, pulmonic, tricuspid, and then the apical or mitral is going to be up under, if they're a woman, it could be up under their breast, but up in this area. So remember, the heart is going to lie to the left, okay? So you have to remember that. Sometimes students get that mixed up, so make sure you know the heart is more to the left. So you're going to name those, and then on your patient, you actually have to listen to their apical pulse. You need to listen to it for a full minute in your checkoff. If it's a regular rhythm, you can just listen for 30 seconds. We're going to use the bell, since our textbook said the bell was best to listen to the apical pulse. So I've got, if you need help with that, you've got the left side. So we're going to look up under, right up in here, and so we're going to listen to his apical pulse for a minute. So you have to have your watch, okay? You need to have that for your checkoff. You're going to listen for a minute, and then you're going to tell me about it. You're going to tell me the rate. That's a number between 60 and 100. You're going to tell me the rhythm. It's either regular or irregular. That would be normal or abnormal. And then you're going to tell me about the quality. It's strong, it's bounding, it's weak. Then you're going to tell me the S1 is best heard at the apex. The S2 is best heard at the base. Then you have to talk through the different pulses. You can either show me on your patient or you can show on yourself. You can just talk through them. You don't have to palpate and feel each one. Eventually in clinical it will be great to learn that and to feel them, but for this checkoff, you've got the temporal, the carotid, which we'll come back to because you also have to listen on that one. You do want to only palpate that one at a time, not at the same time. The brachial, okay, there's the femoral, the popliteal, and then you have the dorsalis pedis, and then the posterior tibial. Did I get all of them? Then with the carotid, you also want to come back with your stethoscope. You're going to listen with the bell at the carotid artery for a bruit or a whooshing sound, which would be abnormal. You don't want that. Okay, but I think that's pretty much it. Do we get it?